Good morning. You're listening to Kingston Community Radio, AM 920 and 92.5 FM, WGHQ, Kingston, New York. This programming is brought to you by our listeners and corporate underwriters who are interested in presenting local community radio. The opinions expressed on this program do not represent those of Pamel Broadcasting or Kingston Community Radio. Listeners are encouraged to send in $10 per month to help bring this program to you. Mail your contributions to Kingston Community Radio, Post Office Box 4364, Kingston, New York 12402. For more information or to donate online, visit our website at mykcr.org. And good morning, this is Dan Gatis, and thank you for tuning in, sharing the morning with us, being early birds on this 29 degrees, Monday, November 29th, actually. And we'll be right back after these messages.
Okay, let's settle down. Since today is career day, stand up and tell the class what you want to be when you grow up.
I want to be a pilot,
soccer player, fireman,
a judge.
Kids dream big. As a parent, you can protect those dreams by keeping your kids healthy well into adulthood. If your son or daughter is 11 or 12 years old, the American Cancer Society recommends giving them the HPV vaccine to help protect them from 6 types of HPV cancers later in life. To learn more, visit cancer.org/dreambig.
Hey everybody, Rachel Ray here. Nothing brings a bigger smile to my face than cooking up a big meal for the whole family and lots of friends. But there's not enough room at my table for the 17 million kids in our country who struggle with hunger. That's why the Feeding America nationwide network of food banks collects surplus food to give hope to hungry kids. But they can't do it without your help. Support Feeding America and your local food bank at feedingamerica.org.
A message from Feeding America and the Ad Council.
This is Cameron Rylands. Many families in our area will not have a happy holiday, and the WGHQ Happy Christmas Fund will help them. We are asking for your contribution to purchase children's clothes, toys, and food for seniors. You can drop off your contribution at the Boyce Brothers Dairy Milk House on O'Neill Street in Kingston. Thank you.
And we're back, and thank you for listening to KCR, Kingston Community Radio, AM 920, 92.5 FM, and streaming online at mykcr.org. Your community radio station. 331-9255 is your call-in number. That is your call-in number, 331-9255. A little bit about the weather and forecast. We certainly did wake up to a frosty and cold morning. It's 29 degrees still here in uptown Kingston, but it's going to go up to 40 degrees today, and we'll have some partial sunshine today as well. A few flurries or snow showers are possible, and mainly clear skies tonight with a low of 22, and then Tuesday, it's going to be a bit overcast with a high near 40, and Tuesday night, partly cloudy with a low back down to 29 degrees again, and then Wednesday, quite cloudy early with some decrease in clouds later in the day, a little bit more sun with a high of 44 and rain or freezing rain on Wednesday night, so be careful. And also be a little bit careful this morning. The roads are slick in some areas because there was some snow and there was some rain overnight, and some of it froze. So be careful. And let's get to the on-air studio. And Dr. Ed Alio is here today for this Monday, November 29th. And good morning, Dr. Alio.
Good morning, Dan. How are you, buddy?
I'm okay. It took a few minutes to condition the car.
Yeah, it's a little cold. It was colder yesterday, though. I think my car was still frozen today, though, Dan.
Yeah. Right.
Good morning, everybody. I want to talk a little bit about hearing again, since that's my profession. I'm an audiologist here in Kingston and have been here for years. I've been on staff at the hospitals, Benedictine, Kingston Hospital, and Northern Dutchess at the time. And people always ask me a couple of questions, and there's a couple interesting problems that individuals have that sometimes go unrecognized or untreated, I should say, And one of them is sudden hearing loss. With a sudden hearing loss, individuals have a difficulty hearing in one ear usually. And it happens something like this. They'll wake up in the morning and they'll have like a fullness feeling in their ear. And many times they don't take too much concern about it, and they let it go, and they think it's a cold or something like that, a stuffiness, if you will. Sudden hearing loss is something that needs immediate attention. And many times it gets masked by how patients talk to their physicians. They may go to urgent center, or they may see their physician, family physician, and say, I'm not hearing too well in this ear. And then they'll start to tell them that their nose is stuffy, or they have allergies, or other things. But in reality, one ear is significantly more involved than the other ear. And if a person has hearing loss already, an older person or somebody who works in noise, which is another instance of fullness feeling in the beginning, when you're exposed to noise in the beginning, one of the reasons you can tell if you have a temporary hearing loss is you get that fullness feeling immediately after coming out of a concert, for example, and then you will have a ringing in your ears, and it goes away the next day or two. But if you put yourself in that situation again, the fullness feeling, ringing happens again. After a few times, the fullness feeling goes away, but the ringing stays. That means you have a hearing loss from noise, and it's high pitch. The problem I'm talking about is the sudden hearing loss. With a sudden hearing loss, a person, as I said, will wake up or just all of a sudden have a pop in their ear and their hearing goes down. What happens often is they get treated with antihistamines or with antibiotics, and it doesn't get any better in that one ear. So this is usually a result of a virus. And by a virus, I mean you could have had a cold, you have a weak ear from the cold, and you lose hearing in that ear. So what do you do about it? Well, let's talk about if you don't do anything about it. Treatment program is pretty interesting program in the sense that it doesn't take much. It takes a antiviral drug, or you could also, and you have to rather, have some kind of steroid like prednisone. And if you don't treat the person within a week or two, that hearing loss can be permanent. Now, the results. Well, the results are, if treated on time, the individual could regain their hearing again. In like 70% of the cases, their hearing comes back in that ear. Many times, for some people, we only get partial hearing back. They're not as bad as it was because it boils down to a pretty severe hearing loss when untreated. So to get their hearing back to normal is the goal. To get it back to near normal would be a secondary goal, but just as good. So treating is important. But the individual has to have a hearing test. So the first thing that has to happen when you lose your hearing suddenly is to see an audiologist or an ear, nose, and throat physician who has testing in their office. That's how you tell if you have that kind of hearing loss. By just going someplace, urgent center, and seeing somebody and not be tested, you can't really tell what kind of problem it is. So it's a pretty significant situation to lose your hearing in one ear. Well, some people say, well, I hear out of one ear just as good as I do out of two ears. Well, that's not true. If you can only hear in one ear, or you have a significant hearing loss in one ear over the other ear, a couple things happen. And those people who have hearing loss in general will be able to identify with this, is that they don't hear in background noise. They can't tell where sound's coming from when you have one ear worse than the other. They have difficulty, because it's usually high pitch, with children's voices, accents, women's voices in general. So it's very difficult. It's fatiguing in a sense because you have to really attend in those situations to hear. So it is a problem. Treated can regain most of your hearing. But again, I have to stress, the only way to find out if it's a cold, for example, or stuffiness, or a virus, is to have a hearing test. And that's important because it's a permanent situation if it goes untreated. Now, having said that, let me also have a caveat here. In some cases, and this doesn't mean that you don't do anything, but I know some people say, well, he said, there is a spontaneous result and your hearing comes back on its own. That is very rare. Matter of fact, in my career of 35, 40 years, I've only seen that happen once when someone's hearing comes back. But in all the rest of the cases, the hearing doesn't come back. And going untreated, it's permanent. Also, interesting is that we have a week and a half to do this. The literature says you got to do it within 3 or 4 days. Well, that's a hurry up, let's do it. But if you're past 3 or 4 days, pursue anyhow. And no matter who you talk to, and they say it's been a week or 2 weeks, you still should have treatment. And the steroids and antiviral drugs are the choice of treatment. And the reason I say that is because I've had patients who were 6 weeks out and been treated and they regained their hearing. So you never know what the real situation is and who's more compliant with regard to the medication and if they'll be helped with the medication than not. So it's always important, even if you have hearing loss and you think you're a week or 2 out since the sudden situation, please pursue anyhow. So, having said that, let's talk about another situation that's also sudden, and that's vertigo. Everybody likes vertigo. One thing about vertigo, Dan, patients who have vertigo are always very compliant. They'll do anything you tell them to do because they don't like how they feel. Now, there's dizziness, which is a global term. You're dizzy. Oh, by the way, the old term for Old English term for dizziness was giddy and also gay. So those two terms also beget dizziness. But having said that, the dizziness we're talking about is vertigo. So there's 2 kinds of dizziness. One is peripheral, meaning your ear. Regarding your ear, we're talking about the semicircular canals. You remember those little, when you took biology in grade school or high school, you had the ear had 2 parts to it. The cochlea, which is the hearing mechanism, and the semicircular canals. And within those semicircular canals, fluid moves around. So when you turn your head quickly or you bend over or you lean back, that's how you maintain your balance. That's what does it. So the issue is if there's a problem in the semicircular canals, you have vertigo. Or if there's a problem with the nerve going out of the ear to the brain, which is the 8th nerve, there's another problem called an acoustic neuroma. That's a tumor, a benign tumor in most cases. And people who have that also are dizzy. The reason that happens is because coming out of the ear, you have the semicircular canals, balance part, and you have the hearing part, and they run together into one nerve called the cochlear nerve. So if there's pressure on that nerve, for example, there's a tumor, which is benign in 99% of the cases, the patient is dizzy. So that's a spinning dizziness. So vertigo is a spinning dizziness. When you roll over, you're dizzy. When you turn suddenly, you're dizzy. When you bend over, the room is spinning or you're spinning. Now, the other kind of dizziness is more of a lightheadedness. So if you bend over and you put your head up and you feel like you're swimming, your head is swimming, that's different. If your head is spinning, that's vertigo. See the difference?
Yes. Yes.
So it's important to check out either one, by the way. Usually the vertigo is disconcerting because it comes on rapidly and is debilitating. People can't get out of bed, they don't want to do anything, and they're dizzy. So what have you ever had this? Well, spin around a little bit, and you know, remember the old days you could spin and you'd be moving and twirling around? That would be like vertigo. That's your semicircular canals doing that to you. The other one is some poor guy who drinks too much and becomes inebriated. They have the same situation. They're spinning around. At the same time, not only is their ear affected with the alcohol, but so is their brain. So they have two things going on. They stagger when they walk. That's your brain. They're dizzy when they turn their head and they spin. That's their ear. So you've inebriated both parts of your head, your cerebellar, which is the back of your head, and your ear, which is the vestibular portion, or the peripheral portion of your head. So what happens with both cases, person who's been drinking or the person who's dizzy, if this is hard to do, everybody wants to close their eyes when they're dizzy, which is almost like a reflex. Close your eyes. Well, try to keep them open. Don't close your eyes and look at something, like at your thumb. If you stare at your thumb, that will slow down the spinning. It's hard to do in the beginning, but it works. Same thing with somebody who's been drinking too much, not that you can get them to do it. And the other part is that if you notice people who are dizzy from vertigo, and doesn't matter the etiology, the cause, oftentimes they vomit. And they do that because it's a reflex from the vagus nerve. So you have all these nerves, 12 of them in your body, and somehow they interact with each other at different levels for different reasons. So you have to be cognizant of what's going to happen. So keeping your eyes open will also help people from not vomiting. Closing your eyes causes you to become more unstable. You get a reflex from the vagus nerve, and people get sick. So let's get back to the sudden vertigo, or sudden dizziness. With my background and my history of treating people who are dizzy and evaluating people who are dizzy, one thing that I notice is that the sooner they are tested, and you need a hearing test, and then you need to have another test to find out, and we can do this clinically, some simple clinical test to tell if it's your ear or not your ear. And then you treat those people, and guess what? You can treat them with the same medications. You can treat them with the prednisone, and you can treat them with antiviral drugs. So the result is they get better over time. Now, people who are dizzy from their ear, which is called vestibular neuritis in most people, Or the tumor is a different situation. With the tumor, it's either a surgical case or radiation, and that helps solve that problem somewhat. The medication can help, but there's different kinds of medication. If you go, many of these people, unlike the sudden hearing loss, will go to the hospital. They'll go to the urgent center, they'll go to the emergency room, and they'll say they're dizzy. And they'll get a CAT scan and to make sure they don't have a tumor, that acoustic neuroma. And 98% of them don't have a tumor. So it's vestibular neuronitis, and then they're given medication at that point, but it's not the steroid. They're usually given antivert, meclizine, which basically sedates your ear. It doesn't solve the problem, it just sedates your ear. And you feel better, but you're sleepy. So it's a tough situation, but that's the usual treatment, and it works, by the way. It works, and people get better. The caveat to this, from my point of view clinically, is if the person is dizzy, has the first time vertiginous episode, they are treated like the sudden hearing loss. They can solve the problem. If you're not treated the first time, then it becomes episodic. You become dizzy again some other time. And what often the triggers are, you don't feel well, your immune system's down, or you're drinking, or you drink too much caffeine, and it kicks your ear and it makes you dizzy again. And this can go on again at different times, different months, different years. But with the medication, at least in my experience, it solves the problem. The sad part is most people don't do it. Most people end up with antivert, which is great, by the way. It solves the problem immediately, but it'd be nice to do both instead, and you're less dizzy.
Dr. Alio, what is antivert?
It's like meclizine. It's sort of a sedative almost. It affects the ear and makes you antivert, less dizzy. See, with the word vertigo. So it's a scary situation for most people. Now, there is like a physical therapy type thing, but it's not really physical therapy. It's a maneuver called Epley, E-P-L-E-Y, Epley maneuver, and it's really a great maneuver. If anybody out there is vertiginous, is dizzy episodically, and you were to call the station here, Dan would put you in touch with me, and I would give you a video. It's really a great video, too, by the way, explaining the maneuver, if you will, of how to mitigate your dizziness. And by that, I'm saying that, remember I said the semicircular canals, there's 3 of them, and one of them makes you dizzy, horizontal or superior. Either one can do this to you. But if you do this maneuver, what it does is it resets these things called otoliths. Well, what's that mean? Well, you know the globe you get at Christmas time? You turn it upside down for Santa Claus and it snows back down. You know that globe? Well, picture that as being the same thing in your canals. So what happens is in the globe, all that snowy stuff is sitting at the bottom of the globe. When you turn it upside down, it becomes loose, it's no longer anchored, and it's floating around. Well, that's the quintessential of what happens with vertigo. These otoliths become dislodged, and they're floating in the canal. They're moving in the canal. When they move, guess what happens? You get dizzy. So the maneuver allows you to, in essence, reset those otoliths back down in their anchored situation. Well, what's that mean? Well, that means that you're less dizzy, and it works. It sounds like hocus pocus, but it really does work. and it helps many people. The secret is you don't do it once. You got to do it often. So if you're a person who is not dizzy now, but becomes dizzy off and on, and it's more frequent than you'd like, this is a maneuver that you could do in between and do it consistently. It's sort of like working out. If you have a bum knee and you need to walk more often, you do that. If you have a cardiac condition, they want you to walk for a half hour, at least 30 minutes, 150 minutes a week, and that makes you feel better. Well, this is a maneuver that you can do by yourself, follow the video, and it could help ward off future dizzy episodes. So I think that's pretty interesting. What do you think, Dan? Is that interesting?
I think that's an incredible explanation, Dr. Adalio. That was an incredible explanation of something that, and it's probably a little complex, but it has to do with, if you watch the video, is it presented on YouTube?
Yes.
Okay, and if somebody just
it's a physical therapist.
EPLEY maneuver.
So I've seen a number of these videos.
Okay.
This one is the best. This woman,
okay.
And I don't know her name. I'm sorry. I like to give her a plug.
Exactly.
She's outstanding. And the other secret to this, Dan, is when you do the maneuver, and you get done, and let's say that, the idea is to relax afterwards for a period of time, not to just bend over again and turn your head and do all that, because they're not set yet.
They're not set yet.
You didn't lodge. They're not reset, and you dislodge them again, and you're dizzy again. I mean, not dizzy at that moment, but it didn't do the job, or you could become vertiginous at that moment. But doing the maneuver does not make you dizzy.
Fantastic. That's an incredible reset. Now, you were talking about the different cells that were inside the semicircular canals that need to be reset. What were they called again?
Oh, they're called otoliths. Not important.
Otoliths.
Yeah, they're kind of like these little things.
Okay, but that is that's the critical particles that are inside your semicircular canals. Huh?
Yeah.
Okay.
And it's kind of a fun thing. I have my computer here, Dan, and I'm trying to find the video by this lady, and I can't find it. Darn it!
Don't.
Well, I'll keep looking during the break.
Yeah, exactly.
And we'll find it.
Yep. Okay. How to now on the other side of it, we're talking about vertigo and things like that. On the other side of it, it begs the question how incredibly well your semicircular canals are working when you're playing football, when you're doing gymnastics, when you're on the beam, and when you're doing incredible sports. The kind of balance that you've been able to achieve, and that all comes from the semicircular canals too.
Yeah. It's and also the back of your head too, Dan. Your cerebellar, which is the lower part of your brain, that also has to be in play, not just your semicircular canals. In the sense that the difference between vertigo and dizzying and lightheadedness is the individual, the older person you might see, who walks and does this, kind of like doesn't stagger, but has a wide gait and shuffles their feet. That's because they have to keep their gait apart so they can maintain their balance. That's not vertigo. That's a different situation. And as you get older, people tend to walk more like that. And they're more unsteady on irregular ground, hills, bumps, or icy conditions. It's kind of scary for them. There's 3 ways. This is kind of interesting in itself, Dan. There's 3 ways you stay upright. Your eyes, your ear, and your proprioception. Proprioception means where you are in space. That's your cerebellum.
That's the cerebellum.
So if any one of these is affected, you're less stable.
It's not triangulating.
Right. Good word. Triangular. I like that one. I never thought of that one, Dan.
Now it's very interesting. What was I going to say? Many times, Dr. Eric Stanberg mentions physical conditions that are incredibly interrelated, just like you're mentioning right now. Right. And I think that that's very, very important takeaway, is that many, many conditions that we find ourselves in are very interrelated with various glands and various neurological systems and things like that. Amazing.
Yeah, it is pretty interesting. There's even there is a I just popped in my head another phenomena called referred ottalgia. Ottalgia means your ear, and people will have pain in their ear canal, and you look in, there's nothing there, and then you look in their throat, and you may see an inflamed tonsil or something else going on at the base of their tongue. Or they may have a pain in their throat, and there's nothing in their throat. You look in their ear, and you'll see an abrasion or something else in their ear. So the nerves between the two are related. It's a branch of one of the same nerve, and you get referred pain.
That is fascinating.
Sort of like the phantom pain idea, I guess.
Yeah.
Right?
Okay, we'll take a break.
Okay, let's take a break.
Thank you, Dr. Ed Alio, for this first half hour and extraordinary revelations in regard to our inner ear and everything about vertigo and things like that. You're listening to KCR, Kingston Community Radio, on AM 920 and 92.5 FM. My name is Dan Gatis, and it is 7:31 a.m., Monday, November 29th. 29 degrees now here in Uptown Kingston, and we'll be right back after these messages.
As warm days slip away and the weather gets cooler, most of us will begin restarting our home heating systems. And that's when the threat of carbon monoxide poisoning is most critical. This potentially lethal hazard can occur with any furnace or boiler, so be sure to have yours professionally serviced regularly. Make sure chimneys and exhaust vents are clear, and use carbon monoxide detectors throughout your home. Central Hudson reminds you, your safety matters.
Electrical fires can be caused by overloaded circuits or outlets, frayed wires, faulty appliances, or deficient cords. This is Central Hudson reminding you, in the event of an electrical fire, call the fire department and let them know it's an electrical fire. Never use water to put out the flames of an electrical fire, as that may cause serious shock. And use only an approved fire extinguisher. If possible to do so safely, shut off the main breaker. Your safety matters.
This is Nina Postupak. Once again, the WGHQ Happy Christmas Fund is asking you to help the needy this holiday season. For the last 50 years, the WGHQ Happy Christmas Fund has helped less fortunate families have a happier holiday. Look for our collection boxes at the local branches of the Ulster Federal Credit Union, Roundout Savings Bank, the Mid-Hudson Valley Federal Credit Union, Ulster Savings Bank, and at Cantine Field and Saugerties. Thank you and have a happy Christmas.
And we're back, and you're listening to KCR, Kingston Community Radio, AM 920 and 92.5 FM. It's now 7:33 a.m. and 30 degrees right now here in Uptown Kingston. We started out with quite a lot of frost in the morning, and still be careful on the roads this morning. Cloudy skies early, followed by partial clearing, and it's going to be a high of 40 degrees today, and it's going to go down to 22 degrees this evening with mainly clear skies. Overcast tomorrow with a high near 40 on Tuesday, and Tuesday night partly cloudy with a low of 29. And then Wednesday, quite a bit of cloudiness with a little peaks of sunshine, some decrease in clouds later in the day, and a high of 44. And Wednesday night, rain or freezing rain becoming likely after midnight, a low of 31. So be very, very careful on Thursday morning. Let's get back to the on-air studio with Dr. Ed Alio and our new guest. Thank you.
Thanks, Dan. I do have a guest with us, a nice young fellow, John DeGasper. I've known John since he was in high school. We met years ago, and he's a outstanding attorney here in Kingston, New York. How you doing, John?
I'm doing well, thanks. Thanks for having me on.
Well,
I was telling somebody the story about how you and I met
was that right?
many years ago. So fond memories. I have good memories of you.
Well, that's good. Anyhow, John heard us talking about vertigo, and he was telling me that he has a relative who is unable to drive now because she has episodic vertigo, which is not uncommon. So the epi might be something that I can hand off to you at some point.
Yeah,
John.
sure.
So John's specialty is what's the term you use? Personal injury law.
Right.
What does that mean, John?
Well, so the cases I handle are filed under tort law. So it's the idea of a civil wrong being committed against someone, and under our law here in New York, and most all 50 states offer some level of tort law, you can be compensated for a civil wrong.
What does that mean? Tort law and civil wrong. What does that mean?
So it means that if you are injured due to someone's negligence, you can file a civil action, a lawsuit against the tortfeasor, they call them, the negligent party, the person who causes you harm. And if you can prove that the individual deviated from something that a reasonable person would have done under those same circumstances, you're entitled to fair and reasonable compensation for your injury.
Oh, okay. Well, that makes it a little clearer.
Yeah, there you go.
Than tort law.
Tort law, right.
We like all those terms. Right, Dan?
I like torts.
So, we're talking about dizziness.
Right.
And I can remember one time I worked with your firm years ago on somebody who was injured as a result of a head trauma. And they were vertiginous, they were dizzy. So it happens. The most significant case I ever had was a fellow who was working on a car. And this is something to think about all the time. And they took their, they were hooking up to their battery in their car. And they hooked the battery up. And as soon as they hooked the battery up, the battery exploded. And the guys went up and hit the hood of his car and was injured. And as a result, he was very vertiginous for a long time, and permanently vertiginous, by the way. So that's a head trauma situation. So
I think the firm's biggest recovery on record involved a woman, a local sheriff's deputy, who had a motorcycle accident, and she suffered a number of injuries, but her most valuable injury, if you will, was vertigo. And it was permanent. They took her sidearm away. She wasn't able to use her pistol anymore. Couldn't ride motorcycle. Lost her job. So vertigo. I see vertigo every day.
Yeah. It's as I was saying during this last half hour. It's very common for a variety of reasons. Oftentimes, it's nothing to do with injury. It has to do with a virus for most people.
Is that right?
Yeah. So it's important that the person first gets a hearing test to find out if it's one ear worse than the other, because it usually is. And you can tell that from a tumor.
So how does vertigo, what is tinnitus? Am I saying that correctly?
Tinnitus.
Tinnitus. What is that?
That's ringing in your ear.
Okay.
People who have the tumor have a tinnitus. And there's different kinds of tinnitus: ringing, roaring, hissing, buzzing.
Okay.
They're all tinnitus. The person with the tumor has a roaring sound in their ear. And they have hearing loss in that ear. And they're also dizzy, vertigo. The average person who has noise-induced hearing loss from either the job or loud music or however they listen to stuff, whatever they listen to, they have ringing in their ears. And I mentioned earlier, the difference is that the person who has noise-induced hearing loss initially starts out with a temporary problem. So they'll be exposed to noise, and then they get a fullness feeling in their ear. Have you ever gone to a concert, John?
Sure, many, yeah.
When you come out, you get a fullness feeling in your ear, kind of funny feeling. It doesn't hurt you at all. And then you have ringing. And the fullness feeling goes away and the ringing goes away unless you reintroduce yourself to that situation. Eventually, the fullness goes away, but the ringing doesn't, and it stays there.
Interesting.
Yeah, that's vertigo. I mean, that's tinnitus.
Gotcha.
Yeah.
I see that a lot in my practice as well. I usually see them together, too.
They are together. They do that, but usually it has to be a hearing loss, and with it, they have to have some kind of hearing loss, or they can have high blood pressure. Your ear is a good monitor of what's going on in your body.
So can you test for tinnitus?
Yeah, you can test for tinnitus. We can test their hearing, and then we can match the tinnitus. We can tell how loud the tinnitus is by matching it. Then we can make it go away by masking it.
Can you test for vertigo? Or is that clinical?
No, well, you can test for vertigo. I can test for vertigo clinically really quick, but there's also a test called VNG or ENG. So it's a simple test, vestibular test, and it's done easily. Yeah, it's a good test too, and you can see the difference between their eyes and because you track their eyes.
Right.
And it's kind of cool.
Yeah, I asked because in my line of work, everything has to be proven objectively, right? We don't like cases where the doctor's making a clinical opinion, but it's not supported by any type of objective diagnostic study.
Well, the ENG electronystagmography, STIGMAS, is very valuable, and you got a visual one too now, which is the new one. So it's pretty good.
Interesting.
Yeah. So tell us more about what you do, and how long you've been doing this, by the way.
So I've been practicing, I think I'm in my 11th year now, so it's hard to continue justifying or categorizing myself as a young lawyer, but 11 years, and for about 9.5 of those years, I've focused on personal injury and medical malpractice work.
And what's the draw for you? What makes that interesting to you?
So it's interesting because when I went to law school, it was not interesting to me.
In what sense?
I think that I had a low respect for personal injury lawyers. I didn't know anything about them. I had never interacted with one. I didn't really know any. I never needed one. So I went to law school. I fell in love with the litigation world and process, the court system. So I knew I wanted to litigate. And then one day, my first year in practice here in Kingston, this case came across my desk involving this woman who had been dropped down a small flight of stairs, an elderly woman, by an ambulette driver. And she was seriously injured. She needed help. And I fell in love with the idea of helping her. And I was able to help her. I loved conducting the investigation into the matter. She was very seriously injured and got her a great recovery, and I fell in love with it and realized that's what I want to do.
Yeah. So what is your firm?
I'm a partner at the law firm of Bosch & Keegan. So our main office is here in Kingston, and Eli and Maureen are the founding partners, and they've been doing this for 30 years probably, plus 30 plus years.
Yeah, I know Eli. I don't know Miss Keegan at all.
Yeah. So she actually heads up most of our medical malpractice cases. We all handle our own, but Maureen has significant history handling medical malpractice cases. She came from a pharmaceutical background. She was a pharmacist by trade, and I think that exposure helped her succeed. She used to defend the medical malpractice cases a long time ago, and then she switched to the plaintiff side, and so she has a tremendous amount of experience, but we all handle our own medical malpractice cases.
And how do clients or patients, how do they get to you? I mean, what's the...
So the phone is the lifeblood of our law firm.
Right.
People are using the internet more, to initiate contact. But if you were to call our office with respect to a medical malpractice case, if you have a fact pattern that interests me, our first phone conversation is going to be 45 minutes to an hour. So, yeah, there are a lot of questions. The chronology of events is very important. You have a shorter statute of limitations, and so oftentimes you're immediately concerned about when did this happen. Because I think with medical malpractice in particular, people are calling you as they're kind of coming out of the process, like they've been wronged. They've already suffered. They've had whatever corrective procedures they may have needed, or they're on their road to recovery finally, and they may call you a year later. And when you're a year into a possible medical malpractice claim, you've lost half your time, right? I mean, you only have 2.5 years. They're very
That's the statute of limitations of the time.
2.5 years. That's how much time you have from the date of negligence to file a civil action. Now, it's interesting, so that's a shorter statute of limitations as compared to general negligence, which is 3 years. So we've had it's effective lobbying by the medical industry, but it's also one of the statute of limitations that affords the greatest number of tollings. So you can extend that for various reasons. So if a physician were to leave a clip behind during a surgical procedure, if you don't find that clip for a year and a half, it's extended. Right. Failure to diagnose cancer. The whole idea of that type of claim is that the doctor's failure to diagnose timely has cost you time. So if you don't find out that should have been diagnosed 4.5 years ago when you had a certain type of scan, your statute of limitations is tolled, and there's other tollings as well.
Yeah, that's very interesting. So I guess a clinical hiccup is a malpractice. I mean, sometimes clinically we see people, we treat people, and you do miss things initially, and there's obviously gross negligence too. So how do you know the difference when somebody, it's not, because medicine, even scans aren't 100%.
Sure, yeah, and I thought we would talk about this when I was thinking in my head, what are we going to talk about? And I thought we would talk about this. If you call my office thinking you were the victim of a medical malpractice, I'm looking for extraordinary damages, because of various reasons, one of which is that I respect the medical profession. I respect the physicians and their reputations. So I'm not going to file a medical malpractice lawsuit against a physician or local practice or hospital if the negligence did not result in harm, right? It's an imperfect world, medicine. It's not an exact science. And so unless the physician or medical provider commits a negligent act that results in extraordinary harm, I'm not going to take that case, because I'm not going to scar the physician's reputation. I don't have the time or the resources to dedicate into a case that won't yield damages. And so, and there's also an issue about causation, and this happens a lot with medical malpractice cases. You may be able to prove that the medical professional was negligent, but you also have to prove that the negligence was the cause of a harm. And some people with a lot of comorbidities and complicated medical histories, it can be hard to prove that the negligent act resulted in the bad outcome. They may have been destined for that bad outcome anyhow.
Well, interesting. I had a case about 10 years ago where I was cleaning a guy's ear, and there's no problem. We cleaned his ear, and I don't know if there was a little blood as a result, scratching his ear. I can't remember that. But he then went to Florida and decided that, I hurt him. But his complaint was dizziness, vertigo. And, so we tested his hearing. His hearing was perfect. So he didn't have a hearing problem. And we even, his complaints were he had wax in his ear, and that doesn't cause the kind of problem that lingers on. And they even did an MRI to rule out that tumor. He had nothing wrong. So it was coincidental that he had something like vestibular neuritis, where he had a virus.
Right.
And nothing to do with the wax and nothing to do with the tumor. And it went, and this was months after, too.
Sure.
It wasn't like you said, time went on
Time
from
went
when
on.
I saw him to when he ended up in Florida.
There's also something, the law recognizes that that medicine is not an exact science, that there are certain risks to every procedure. And so if the damage or the harm was a foreseeable risk of the procedure, and if the physician informed you of the risks associated with that procedure, you don't have a case. That's not a good case, because bad things happen when physicians are conducting intensive, invasive, complicated surgeries. It's when the outcome was not foreseeable, when the patient was not advised of the potential for that outcome. That's when you have a decent case.
I'm just thinking of all the surgical things that happen to people. When are they not informed of the outcomes?
So it's very difficult to prove. Lack of informed consent is actually its own cause of action in New York. So if a physician fails to tell you this potential thing could happen during the procedure, you would have a cause of action based solely on a lack of informed consent. It's very difficult in today's day and age to prove lack of informed consent because the computer systems and the medical record systems that physicians use have a little button that you click, and by clicking the button, on the medical record appears this big long statement saying, I told the patient of all the risks. And it's a generic consent. It doesn't really say anything specific, like, hey, if you're having this brain surgery, we could puncture an artery or something. It just says, I inform the patient of all of these different outcomes, and it'll be generic, like it'll mention infection or postoperative bleeding and things of that nature. When people go into the hospital, as they're laying in the hospital bed, being wheeled into the operating room, they sign what they call generic consent. They sign
here.
Yeah, sign here. You know that things may not go well. Don't sue us later. But it literally doesn't say anything specific about the procedure. So
the consent is good or no good?
I think
it's
you know what it is. It's like the waiver at a trampoline park. They're not binding. They're not effective. They're deterrent. By signing it, the business operator hopes to deter you because in your mind, well, I signed that waiver. I signed that consent. I don't have legal rights.
Maybe your other job should be teaching physicians how to write a real one specific to their procedure.
Yeah, that's true. Or, take time to make an actual note about what you told the patient.
Yeah, right. There you go.
Yeah.
That'd be something.
Yeah.
I just had a procedure in June. It's in and out. You go in for a procedure and you leave.
Yeah.
Real simple. And right here in Kingston, and a good surgeon too. I go out and 9 hours later, I'm in the emergency room. Yeah. And then I'm 5 days in the hospital.
Oh gosh, right? Yeah.
So
no one told you that, right? Yeah.
Well, but it happens. Right. It happens.
It does.
You end up bleeding.
Yep.
Because you get nicked somehow.
Well, so this is it. So one of the most common calls that we get in terms of medical malpractice cases is say, a nicked intestine, right? They're doing some type of procedure and they puncture through the intestinal wall. That is a risk of the procedure. So that's actually not a good case, right? The case arises when post-operatively they fail to identify that perforation, that puncture, and it leads to some really awful things. 2-3 days down the road, there's internal bleeding, we have infection, sepsis, or something terrible that is the domino effect of the original, the surgical error. But that surgical error really doesn't qualify as malpractice.
I have another one too, not me, but a kidney stone. Person gets a kidney stone and they have they're also on a blood thinner. Okay, so the surgeon goes in and he attempts to remove the kidney stone, but there's a lot of bleeding as a result of the blood thinner, and the person ends up with a catheter and blood clots in 2 weeks in the hospital, and they can't figure it out, and here we are. This is like 2 months later, and the person still has a catheter and still has problems.
Right. A lot of our cases, I think, involve that issue where it's the secondary layer of information that the physicians fail to identify. So the surgeon is focused on, okay, the anatomy is correct, and they passed their pre-op with the primary care or cardiology, we're good to go, and they overlook the medication. They overlook some type of medication that the patient uses, and then during the procedure, something happens where that medication triggers something that should have been thought out. And so it's that secondary layer of information, I think, where physicians commit malpractice, and then then the patient does.
By the way, this was in Florida, not here.
Gotcha. There you go. The medical malpractice mecca of the world due to the proliferation of. Well, I mean, you have your snowbirds, and the healthcare industry that down there has expanded beyond measure, and so there's a lot of nursing home neglect cases down that way, a lot of nursing home abuse cases. The medical industry is churning out physicians like never before. So, I'm of the school that the quality of care has significantly suffered in our country. Science has improved, but the quality of physician.
Well, I think, from my vantage point, the problem is the technology has outstripped the practitioner in the sense that they no longer are hands-on. They don't do clinical stuff. When I talk to physicians, I lecture to physicians about how do you diagnose a patient. Well, you diagnose a patient by as soon as they walk in the door, you watch them walk in. You see what they do. But if you're busy with your computer and you're there, and this is what they do, right? They do this.
I see it with my daughter.
Yeah. And they're not even looking at your kid.
Pediatrician. They're just in the laptop. Yeah. But yet they turn the laptop around to show you the chart of where your child sits in terms of, the size of their brain or size of their skull.
How they are.
Yeah, right. And it's like, okay, well, that is interesting. But meanwhile, you haven't made eye contact the entire 35-minute appointment with your child, right? So family care, primary care physicians are probably, I shouldn't even say this, I was going to say they're the most insulated from malpractice claims because they're non-invasive, but it's their failure to diagnose, especially in the pediatric world, that can result in significant harm to children if they don't identify a underlying chronic issue.
So when the physician sees you coming, they probably turn the computer
I
around.
always wonder. No one says anything, but they all know.
Yeah, lawyers here. I mean, we all think about it when you see a patient. I have lawyers come in. The next two lawyers would be the people who have technical information, and they would talk about a hearing aid. They know everything there is about hearing, not hearing, the technology.
Right.
They want to program the hearing aid.
Yeah. I got a call from my daughter's primary care physician, pediatric doctor, looking for my professional insights and assistance for a family member, and that was actually a great compliment to me that I conducted myself in such a way that I persuaded a physician to refer, and actually it's happened many times. So
I'm sure. I mean, the bad rap is that medical malpractice, as you said when you first started out in your own love for this field, is that no interest. It doesn't feel right. What's the term they use?
I don't know. What?
I don't know either.
Yeah.
But it's tough because we're on the other end. And how about the patient who, you talk about medical malpractice and then personal injury stuff. The patient that I had fabricated the injury to their ear and tried to sue me. Another person was overweight, fell in my parking lot, but didn't say anything for 6 months. Mm-hmm. That went nowhere.
These are all factors that we take into consideration. More than the injury, more than the negligence, I'm looking to the type of person that walks through my door, right? As you said, as someone who provides care to a patient, you're judging the patient. The moment they walk in the door, what do? I'm doing the same thing because I know that my reputation is connected to theirs if I put their claim forward.
Not everybody is truthful, right?
I'm of the school that most people are. There are certainly liars out there, but I believe that the justice system filters all that out. The justice system, juries, if you believe in the Constitution, if you believe in the jury system, the jury's verdict is just. And I believe that the insurance industry and the court system filters out the garbage, and the cream rises to the top.
Okay, good. We're going to take a break at this point because I got another question for you. Dan, go ahead.
Okay, and thank you. John DeCasper and Dr. Ed Alio today is with us, and KCR is Kingston Community Radio, WGHQ AM 920 and 92.5 FM. It's now 8 o'clock a.m., and it's Monday, November 29th, and 30 degrees right now here in Uptown Kingston. This last portion of Kingston Community Radio was brought to you by Central Hudson. We'll be right back after these messages.
Long ago, you wouldn't think of galloping on a horse while doing calligraphy, and you wouldn't have attempted to ride your bike while typing a letter. Yet you think you can safely operate a multi-ton vehicle while texting? Behind the wheel is no place to multitask. If you want to BRB, drive now and text later. Lives depend on it.
Visit StopTextStopWrecks.org, a message brought to you by the National Highway Traffic Safety Administration, Project Yellow Light, Noise, and the Ad Council.
She can stand, she can do more, like build a rocket and watch it soar, clean the oceans and make the world a better place. Oh, she can STEM.
Learn more at She Can STEM, a message brought to you by the Ad Council.
Hey, so what's a great way to spread awareness that driving high is illegal everywhere? A catchy song, of course.
You can run, but you can't drive high. You can run, but you can't drive high.
Friendly reminder, don't drive high. If you feel different, you drive different. Brought to you by NHTSA and the Ad Council.
Hi, my name's Maggie. I'm from Copake, and I support Kingston Community Radio, and so should you.
And we're back. You're listening to WGHQ AM 920 and 92.5 FM, the home of Kingston Community Radio. My name is Dan Gatiss. 8:02 a.m., and it's 30 degrees now here on this Monday, November 29th. This upcoming segment of Kingston Community Radio is brought to you by Herzog's. Stop by Herzog's Home and Paint Center in the Kingston Plaza for all of your home building, maintenance, and painting needs, and discover the difference of buying local. This portion of KCR is also underwritten by Sawyer Motors. Bob Circasano and the whole Sawyer Motors team are there waiting and ready for you on 166 Ulster Avenue in Saugerties, 12477. Call them, 845-247-5027, 845-247-5027. A little bit about the weather and forecast. Cloudy skies early, and of course we're coming out of a very, very good frost last night, so be careful on the roads. And but it's going to go up to a high of 40 degrees today, and a possibility of a few flurries during the day. Tonight, mainly clear skies, low 22, and Tuesday's going to be overcast with a high of 40, and Tuesday night, partly cloudy with a low of 29, and Wednesday, a little bit of cloudy early, and then some decrease in the clouds, a little bit of sunshine peeking through in the afternoon on Wednesday, a high of 44, and Wednesday night, rain or freezing rain becoming likely after midnight with a low of 31. So careful how you drive and move around on Thursday morning. Let's get back to the on-air studio now with Dr. Ed Alio and John DeCasper. Welcome back.
Okay, we're back with Attorney John DeCasper. John's a personal injury attorney and does some work with malpractice. We talked about the malpractice thing. What about the personal injury? How does it present itself to you? And how significant of a problem does a patient have before you take them on or you don't take them on? How do you tell what a real injury is?
Sure. So with medical malpractice, admittedly, my standard is considerably higher because the cases are more complicated. They take longer. They're very expensive, and you have another professional's reputation on the line. So I want to be really confident about my medical malpractice cases, and I want the damages to be extraordinary. Not that I want that for the individual, but I'm not going to bother with it. Now,
Wait. You said something that I heard before. You said it's got to be big enough or you're not going to bother. Why wouldn't you bother with it? It doesn't pay?
So I'm not really concerned so much about my fee as much as the cases are so expensive that if you take a case, say, where a patient has damages worth $50,000, it could take you $15,000, $20,000 to get it there. And so by the time you take your fee and your costs and disbursements back, the victim of the malpractice nets $5,000, $10,000.
You hand those off to your secretary then?
I just reject them. I don't take them. And so, I just don't take them. So really, it doesn't have to do with my fee. It just has to do with the fact that time is a huge factor. They take twice as long. A medical malpractice case takes twice as long.
And the people don't pay as they go, in other words. They're not paying
Right. So I'm financing the case. I don't get payment. But I just know the challenge. Now, if you contrast my standard personal injury, it's a lower bar. Here's why, right? People sometimes, I think, are offended by like, oh, why would you file that case when the injury is so minimal? So contrast like an ankle sprain versus a femur fracture, right? Clearly, the femur fracture is more valuable. That's a very serious injury. Whereas an ankle sprain, you might bounce back in 4 weeks. What I would say is, well, the small cases are meritorious as well. And the law only allows for the injured person to recover what is fair and reasonable. So if a case has merit, meaning that you can satisfy the 4 elements of a personal injury case, even if it's a small one, I might take that because it's meritorious. It's got validity. I don't mind signing my name to it just because it doesn't have a tremendous value associated with it.
What are the 4 elements?
So you have to show that there's a duty of care. Duty meaning that the person who committed the wrong or the negligent act owed you a duty. So if you're a property owner, you owe people who come to your property a duty to maintain it in a safe condition. If you drive a car, you owe other drivers a duty of care. Whereas, you can't, if you sprain your ankle, you can't sue the President of the United States. He owed you no duty, right? And then you have to show that there's a breach of the duty. So you were looking at your cell phone while driving and you rear-ended me. You breached your duty of care. If I own a commercial piece of property in Uptown Kingston. If my sidewalk is cracked or something and somebody trips and falls on it, I breached my duty to maintain it in a safe condition. Okay. The third element is causation. The breach of the duty has to result in a harm. And so if you can show causation, then you can move to damages, which is the 4th element. So sometimes people call me and they say, somebody acted negligently and I fell. And then I'm like, okay, well, that sounds like a case so far. Are you hurt? Well, I went to the emergency room, but I'm fine. I'm not going to take that case because there are no damages. So you can get your day in court, but you'll only get $1.
Okay, that's interesting. Dan wants to say
something.
Yeah,
just an announcement quickly for everybody who's listening. We don't have any birthdays today. We oftentimes have 3 or 4, and we have a cow pie to give away, but today we don't have a birthday, so make sure you get your birthday both birthday announcements in. Post Office Box 4364, Kingston, New York 12402, or email them in at kcr921@gmail.com.
Thanks, Dan. No cow pie. Anyhow, John wanted to know what a cow pie was, so I had to explain to him.
Now I know what I'll get for my son's birthday coming up.
When's his birthday coming?
December 9. It'll be 2. Yeah.
How old are your children?
4.5 and 2, and I got my hands full. Yeah, but it's a lot of fun.
We have a phone call coming in. Yes, caller, go ahead, please.
Hey, good morning. It's Tony Marmo. I want to say good morning to two great Italians in the studio there. I have two birthday wishes from the Ulster County Italian American Foundation. We need to start getting these birthdays in, but one is Marianne Forgi Lombardi, Les Lombardi's wife. Marianne has a birthday today. And Gerald Salenti has a birthday today on the 29th. So two members of our organization. But since Dan said you had no birthdays, and listening to your great show, Ed, good job. And thank you, John, for being on.
Glad to. Thanks, Tony.
Just wanted to share a couple of birthday wishes of two good friends.
Well, thank you. We appreciate that from one set of Italians to another. So do they get a cow pie?
Well, no, they can't get a cow pie because we have to get their names in, so that's on me. That's on me as president now. So
boy, I feel so left out, Tony.
So. All right, guys. Well, thank you very much. Keep up the good work. It's a great show. Thanks so much.
Thanks, Tony. Take care of yourself.
Tony.
All the best. Bye-bye.
Tony's my mentor here.
Oh yeah, he's a good guy. I that guy has so much energy. I envy him. I don't know how he does it all. I really don't.
He started out. I met him years ago. He was a hospital administrator.
Right.
Hospital.
I did know that. I started
Tony
practicing
Triozzi.
After he
left. Yeah. Well, you only been around a couple of years.
Okay. Yeah.
You have only been around a couple of years.
Yeah, I guess so. But
11 and a half, not a long time for us. Okay. So, well, that's interesting on the personal injury side. The four elements are I find interesting. And it'd be, like you said, it's easier to meet that criteria and than it is to do the medical malpractice.
The criteria are the same. The only difference is medical malpractice. The legal term is medical negligence, and it's a form of professional negligence. So if you're handling a general negligence case involving a fall or a car accident, something of a construction accident, you have to show that the defendant, right, the person who committed negligence, deviated from what a reasonable person would do. In a medical malpractice case, the plaintiff's burden is to show that the physician or medical professional deviated from good and accepted standards of care within the community, right? So you can't use a standard of care from, say New York City, what a New York City orthopedic surgeon would do. You have to show what the standard of care would be here in the Hudson Valley. And but the elements are generally the same: duty, breach of duty, causation, damages. It's just that the investment side of the malpractice is so great that the barrier to entry is different, and they just consume so many more resources that the sort of flow of money at the end is different. And you want to make sure that your plaintiff, your injured person, that you're not leading them on over time, that they're the person who has benefited from the case, not the lawyer. And so the analysis is just a little different from a business perspective on the malpractice.
Oh, that's interesting. I didn't know all this. Well, I knew some of it, I should say, but I didn't know. If you're in business or you're in any kind of a profession, but mostly a medical profession, or if you're in business and you own real estate, you're definitely a target for problems because people do slip and fall on ice. Example would be he's raising his hand like he slipped and fell or something. But like my driveway, because I rent out my office, I have it plowed immediately. But, the ordinance is you got 12 hours or so to make it clean and take care of it. But you can't get every speck of ice off the driveway. So what I did because two people fell. Nobody did anything, luckily, because they fell, And so I block off the driveway and I salt it and no one can go on it.
That's one way to do it,
Try really hard.
Yeah, you can, and again, it's what's reasonable, right? And just because I file a claim, that's my evaluation of, okay, well, maybe it was unreasonable to not block off the driveway or to not salt on a commercial property, within 2 hours of a snowstorm, something like that. That's my initial assessment. If I think the case has merit, I'll file suit. The owner of the property gets a defense. They get a lawyer, they get a defense, and ultimately the jury would decide what is reasonable under the circumstances. Right. And what I think is really powerful about cases is that the jury is often put in a position where the jury, gets to establish the standard for the community, right? So if based on the facts, the jury feels that the commercial property owner should have done something more, well, then they get to set the standard straight. And that's how I usually feel good about the things that I do, because we can either work them out and resolve them, or if the
John,
that is the jury. If we can't agree, the jury gets to decide what the standard should be in the community. But if you're a commercial property owner, I'd prefer to file a case against the commercial property owner versus a resident, but they're all,
John, that is a very, very important point, that, like, we're trying to prevent all these things from happening.
Yeah. Yeah,
ultimately,
exactly.
and to raise the standards and raise the awareness for residents and commercial owners to just raise the standards and so that it's preventative.
Yeah, the business world and it pushes back, right? And think about me, like, I'm a small business owner. I own a law firm. I own real estate, two pieces of real estate in Kingston. So as a personal injury lawyer, I see things one way, and as a business owner, I see things a different way. And, it's all about, again, as I was saying, it's not a perfect world. You can't remove all dangers. And so what's reasonable? What would a reasonably prudent person do?
Interestingly, and we have our next guest coming. I want to thank Jeff for coming. But before you leave, I was in Asia, and it was in Vietnam, I guess. This is after the war. And this guy was walking by a store, and he fell down. And the owner comes out and, oh, I'm sorry. And the guy is, I'm sorry. And the person who fell did all the apologizing.
Well, I don't think in Asia there is no tort law.
I'm sure there isn't.
Yeah, I don't think you can. But
the interesting part is, probably not many attorneys either, that people take care. And they sweep the sidewalks themselves. Is on a municipal sidewalk. They sweep it up. And I saw a guy the other day sweeping a sidewalk here in Kingston. I was really impressed. It was right on Broadway. No, on Wall Street. He was out there sweeping the sidewalk. I thought that was pretty interesting. Not many people. You do that, Bernie?
I do the curb a lot.
Yeah, good. Yeah. So anyhow, Bernie Gray is going to follow you.
He's the man.
Yeah. You know each other? Good. You know each other, right?
So my connection to Bernie Gray, I think, is that he is the individual who volunteers his time for the SUNY Ulster Foundation Gala, and you are the auctioneer.
I am.
And you're phenomenal at
Thank
it.
you.
You're very funny. And I enjoy watching you. I think you could, dabble in comedy, stand up if you haven't already.
I haven't.
Okay.
I haven't. But I have my
you're
own
funny.
show on 27 Smith Avenue anytime I want.
Okay, there you go.
That's pretty good.
Yeah.
But a very generous human being you have here.
Well, I've lucked out in having good people come in, physicians and non-physicians, and Bernie's going to talk about pre-planning. Somebody said, matter of fact, Tony Marmo said, "Ed, you got to do more with medical." I said, "How much more medical can you get?" I mean, you start from cradle to grave, and people have to prepare. And one of the other programs I'm going to do is on wills.
Well, I was just going to say, because you told me why Bernie was here. The one thing I'll leave you with is I remember Trust and Estates, and the professor said that by preparing for your death, you can save your family a lot of familial strife.
That's right.
And then I walked out of Trust and Estates.
There you go.
I'll walk out of here.
Take care of yourself. Thanks, John.
Well.
Good to see you.
Bernie.
Hey, man, be well.
Here, sit here, please. Well, Bernie and I have only met a few times, mostly in East Kingston, I think.
Yes.
With the St. Coleman Church.
Mm-hmm.
Welcome.
Nice to see you.
Thank you.
Good morning.
Good morning. We are going to talk a little bit about pre-planning. Tell us your background and what you do. So I'm sure everybody knows who you are, but tell us anyhow.
So I'm a Kingston resident, and I left after high school to go to college, which was very unusual. I was the only one, probably a very small number of the people in our graduating class from Coleman High School. I was one of the only people who really knew what they were going to do with their future. And I went to Mortuary Science School in Farmingdale, New York. I'm first generation funeral director. I've been licensed now for 37 years.
Wow.
Yeah, long time. I've been in Kingston for 30. Prior to that, I was working and learning my trade in Westchester and Lower Manhattan. I'm married to my wife, Beth, who has a doctorate in occupational therapy and is currently a professor of that study in Sage in Troy. I have 2 sons and a daughter. My oldest son, Will, is actually in the business with us, licensed funeral director. My middle son serves Kingston, New York as a firefighter.
Oh, yeah?
Yep, Central Station. And my daughter is spending my wealth quickly by attending college. Yeah, so she's at the University of New Hampshire, and she's in her final year and has announced that she really doesn't know what she wants to do after she graduates.
It's not so uncommon, is it?
No, it's
they
not.
don't prepare.
No, it's not.
You know, I was in my first career as a college professor for 8 years, and the sad part is I think professors sometimes get young kids excited about what they're teaching, which takes them down some other kind of rabbit hole, which is no job. You know, as good as the class is, it's not going to get them a job after 4 years. I mean, one of them is psychology, for example. Someone wants to go into psychology, they get a BS in psychology, and you can't do anything with it. Then you get a master's in psychology, you still can't do anything with it. You got to get a PhD. So at least in psychiatric social work, you can get a master's and you can go to work and get insurance. Yeah, that's just another story.
And just a thought on school. There is a shortage of people who are actually coming into this profession.
This profession
being funeral service. We have a shortage in the state of New York. After you complete your field of study, you have to do what they call a residency for a year in an operating funeral home. And the amount of residents coming out of the colleges in the state is very few. So,
where are the colleges, Bernie?
You've got Hudson Valley Community College in Troy. You've got State University of New York at Canton. And you've got a very well-known school in Lower Manhattan, which is the McAllister Institute of Mortuary Science, which has been around for decades.
So just 3 places?
Just 3 places.
Not very many, huh?
Not many places.
Is that because of the law? You know, I see, in my profession, they went from a master's to a doctorate in audiology. I have a PhD, so I was there way before. And the result is that they don't have, because of the amount of money it takes to spend 4 more years after your bachelor's, you don't get the people.
Yeah.
And there aren't enough schools either.
And I think if you look at the school itself and offering what curriculum they're going to offer, and as far as attendance and amount of students in there, obviously with the shortage of people even coming into this profession, you know, they look at it and they go, well, this is not a course of study that we want to even offer.
Okay, but then let's talk about pre-planning. But I want to tell you one more thing first. You know, when I left, when I was 18 years of age, I left Rochester, New York, but on my way out the door, before I did get a football scholarship, so that helped me go someplace. But I was going to go to Simmons School of Embalming in Syracuse, I think it was. Isn't that something?
And I think that closed like maybe 15 years ago.
Yeah, right. I don't know.
Yeah. The director of the New York State Department of Health Bureau of Funeral Directing is Dr. Fuller, who was the president of that institution.
That's pretty interesting.
Yeah.
So that's my history. That's my only history. Oh, I also did eye inoculations. Back in the 80s, before AIDS picked up, we used to go to a funeral home.
You're a audiologist doing eye enucleation.
Yeah, I learned. Isn't that something?
Yeah.
It's a head and neck thing, you know?
Yeah, right.
And I did a few with a ophthalmologist, and then we had to stop because of AIDS. They didn't know exactly, you know, we stopped all kinds of transplants at that time. That's the only history I have.
Interesting.
Yeah.
So let's talk a little bit about this
Pre-planning.
thing.
What is it?
Pre-planning is a process by which an individual or couple or family will begin to make plans for the disposition of their bodies when they die. And in that, they will also plan out the financial aspect if they want to, and they'll also plan out the ceremonial aspect if they want to. But basically, what it is to get an idea in the family of what someone wants to have done to themselves after they leave this universe. And it can be very simple, and it can be very elaborate. People are forced to pre-plan and pre-fund a lot of times as they get older in age and they become infirmed in a long-term care facility, meaning that they need to spend some of their funds to be eligible for state and federal aid to take care of them.
So in essence, they're forced to receive care. They got to spend their money, and this is one way to do it. I guess it works out.
It's legal.
It works out. Yeah.
So that's the one thing. The other thing that's really important in this upside down world that we're living in right now is that a person needs to delegate another person to be in charge. You know, once you die, you are no longer in charge of this body. This body is considered by the court as property then. And so someone has to be in charge, and that's the thing that doesn't happen a lot. And I urge everybody that's listening to me today, find someone that you can name as your agent. The most important thing that I see going on right now, and the law is 4201 of the Public Health Law of the state of New York. And what it states is that there should be an agent, and there's a hierarchy of who can legally take care of funeral arrangements.
Well, so how do you get people to beside? You can't put it in your will because you're dead.
Mm-hmm.
Your will doesn't help.
And your will is really, you can put something in your will, but you know what? That will is usually locked up somewhere.
Yeah, and you're already buried or
gone
by the time they find it. So how do you find an agent? And I mean, normally when my parents died, we just all did it.
Right.
And it worked out.
Right.
And then I see other people whose family dies and there's hell to raise.
Correct. The dysfunction of the family, the breakdown of the family. And that's the most complicated item that we see daily when we deal with this. And remember, whatever you have as a problem in a family unit, it gets magnified by the death of an individual.
So if there's any kind of family strife.
Yeah. And we have to be careful.
We haven't talked to each other in a year, and now we're going to duke it out for the next 10 years.
And I mean, we just had a lawyer in here, and everybody has to be on the same page of the arrangement, or there can be litigation. And
is that right?
Yeah, and so pre-planning is really important, especially for the husband and the wife to save the children from this burden.
Right.
You know. And in the hierarchy of 4201, the automatic person who can take care of a funeral and disposition would be the spouse.
Right.
Okay? Here number two, the next person, and this is something that happens in our society a lot now, is a true companion or domestic partner. And we have a lot of that situation going on.
Versus a son or daughter.
Correct. Correct. Now, what do you think that does?
I know. I can imagine.
It's crazy. So we need. So that's why someone really should. There's two things. If you're living in that situation, and it's worked out over the years, you should register your partnership with the state of New York. And there's a form that you can.
Right?
Yeah. And you can register it, and you can become a legal couple without marriage, outside of marriage, and you can, and showing that you share responsibility of the household, of the finances.
Okay, what if you just pick somebody, like you're a single woman, and you pick some guy you don't live with?
Yeah. Okay. So
anoint them as the
agent. Correct. But you don't anoint them; you appoint them. All right. And there's a 3-page document. You can find it online. Lawyers have them, and your funeral director has them. And you can come in, you can name this agent. The agent must agree in writing to take on this responsibility. And then that record goes to us, and it goes to the individual, and they keep that on file, and then the agency is taken care of. It can be succeeded or revoked, and then
by the person who,
Right.
by the
Yeah, by the person who has appointed the agent. If there's a problem later on, you can revoke that agency, and you can go into another agreement.
Yeah, that's pretty interesting. We'll talk more about that. We're going to take a break here in about a minute. But, we can talk more about the agent, but also we should talk about how people go about doing this and what's the expense. Do they pay you? Do they save money? Is there a trust for that? What's the legal aspects?
Okay, we'll talk about that.
Thank you.
Thank you, Dr. Ed Alio and Bernie Gray. Thank you so much for being with us today. And it is Monday, November 29th, and you are with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM, 30 degrees right now here in Uptown Kingston. This last portion of Kingston Community Radio has been underwritten by Sawyer Motors. Bob Circasano and the whole Sawyer Motors team are there for you on 166 Ulster Avenue in Saugerties, New York, 12477. You can call them, too, at 845-247-5027, 247-5027. We'll be right back after these messages.
Man, do I love card night. You ready, boys? You got a king?
Go, fish dad.
Oh, come on. This is WWE superstar Titus O'Neil. It only takes a moment to make a moment. Take time to be a dad today. Learn more at 877-4DAD-411 or visit fatherhood.gov.
Brought to you by the U.S. Department of Health and Human Services and the Ad Council.
Look through your children's eyes, and you will discover the true magic of a forest.
Find a forest near you and start exploring at discovertheforest.org. Brought to you by the United States Forest Service and the Ad Council.
What grows in the forest? Our imagination and our family bonds. The forest is closer than you think. Find a forest near you at discovertheforest.org. Brought to you by the United States Forest Service and the Ad Council.
Hi, this is Dina Roy from Hurley, and I support the Kingston Community Radio, and so should you.
And you're back with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM. This last portion of Kingston Community Radio was brought to you by Sawyer Motors, Bob Circasano, and the whole Sawyer Motors team on 166 Ulster Avenue in Saugerties, New York. And also Herzog's. Stop by Herzog's Home and Paint Center in the Kingston Plaza for all of your home building and maintenance and painting needs, and discover the difference of buying local. Sales ongoing at herzogs.com. Weather and forecast for Kingston and the surrounding areas. Cloudy skies early, and be careful. There's probably still a little bit of frost and ice on some roads. But we're going to have some partial clearing, possible a few flurries later on today, and a high of 40 degrees. Mainly clear skies tonight with a low of 22. And Tuesday during the day, it's going to be a little overcast, a high near 40 degrees. And Tuesday night, partly cloudy with a low of 29. And Wednesday, considerable cloudiness early, then some sun peeking through later on in the day. It's a high of 44. Now, Wednesday night, rain or freezing rain becoming likely after midnight, a low of 31. So be very careful Thursday morning after that rain and freezing rain overnight. We've got a low of 31, so it'll probably be pretty icy on Thursday morning. Let's get back to the on-air studio. This upcoming portion of Kingston Community Radio is brought to you by Ulster Savings Bank. Many locations throughout the Mid-Hudson Valley, one near you. Okay, now let's get back to the on-air studio with Dr. Ed Alio and Bernie Gray. Welcome back.
Thanks, Dan. Hey, Dan, Bernie was just sharing something with me so you could do some research for us, Dan. And that is, he heard there was a state of emergency in Kingston.
I'll look.
Look and see. Let us know.
Countywide?
Let us know.
Maybe?
Okay.
Let us know. Thanks. Anyhow, so we were talking about pre-planning and what that means and cost and what people do, and because I would say most people don't pre-plan, do they?
They do not.
They just die.
Yeah, but a great amount of people do it. Once they hear about a friend or relative who's done it, and they see the sense in it. So what they do is they call, they make an appointment, and we get together. It's usually about an hour and a half meeting. It may go into a second meeting depending upon what we need, and we have a discussion about what they're interested in, and a lot of people have the idea, of what they want. They've got a pretty good idea of what they want. They just need to eat to finish it. They need to buy a
How do they pay for it? What do they do?
Okay, so a lot of people fund from their personal funds. They write a check, and that money has to be placed into a trust. And you mentioned that before the break. So we have to put it into a trust, and then we have to determine whether that trust is revocable or irrevocable.
Their trust, or you have a trust to put it in?
We established the trust with a company that does trusts for
Okay.
funeral homes and cemeteries.
Okay.
Yeah.
So it's not like a state trust?
No.
It's not like a trust that you're responsible for. Is it an interest-bearing trust?
It's an interest-bearing trust. Okay, and so we have the option, and we still fulfill the option. It's not required, but what we do with that interest is we write a guarantee. So that as long as the arrangement remains exactly how it was when it was planned, we use the interest to offset inflationary pressures, and we guarantee that no monies have to change hands.
That's good.
It is good.
And so who pays you at the end? The trust?
The trust, yeah.
And so, and the trust is where? Where is the trust?
Our trust is located in a company that operates out of Connecticut. They're nationwide. We used to, years ago, we used to trust with banks, right? Open up a CD, but then we were responsible for the paperwork and the taxing and the interest, and it was just too much to deal with, especially as the number of trusts started to grow. So then we went and we signed up with this company. And here's the other thing. In the state of New York, if you're going to prepay your funeral expenses, that money must be placed in a trust. It cannot go into the general operating income of the funeral home.
Is that right?
It has to be a separate entity.
That's a law?
It's a law. So what that means is that money's safe. I could go out of here today and lose my mind completely, and that money is still in that trust, and that family could come back into the funeral home and say, we heard that Bernie has gone around the bend, and we want to move our money out of here. And you can do that.
So, two things. Can they, at some point, can the family increase what they want to do for the person who passed away? And secondly, I forgot the second thing. Answer the first one.
Okay, the first one. Can they increase? Absolutely. Okay, and I think we should go into, when we're into this discussion, so they can, you can change the trust as long as it's revocable. You can change the trust at any time. But let's talk about irrevocable trusts. Irrevocable trusts are available to people in New York State who are about to receive assistance from the government, whether it be state and federal, under the Medicaid program.
So that means that in the revocable trust, they can take the money back.
Correct.
And then they can go someplace else? Can they go someplace else anyhow, to a different funeral director?
Yes, you can. And with an irrevocable, you can also move within 30 days. You can take the money out of one facility and the funeral home and go to another one as long as you do it in 30 days.
Okay, I think Dan's trying to tell me something.
Yes, that you had asked about announcement of state of emergency. Ulster County Executive Pat Ryan declared a state of emergency Sunday in response to increasing COVID-19 cases and hospitalizations in Ulster County and the emergence of the Omicron variant, a press release from his office announced. The order in effect At least 30 days will allow the county to obtain more quickly needed testing supplies for local schools, businesses, and families, bolster available public health and medical staff resources across the county, and if necessary, to redeploy the workforce, support testing, contact tracing, and vaccination efforts according to the release.
Okay, so he's getting ready in case that virus does get here.
Yep, there we go. Okay.
From South Africa area.
Be prepared. So irrevocable. You can remove it and change it. It's portable, but you have a certain amount of time that you have to reestablish that trust. You cannot remove the funds and use it for another purpose.
Revocable or irrevocable?
Irrevocable. It has to be used for that purpose. Can you add to an irrevocable trust? Absolutely. Can you add to revocable trust? Certainly. And it's done sometimes.
You can't take money out of an irrevocable trust.
You cannot.
Okay, you can only
Okay,
add.
right. So people come in, and here's another thing that they do, and we really don't have a good answer for this, other than the full faith in the insurance company. But some people will come in, and they're highly insured with their lives. And so they'll write up their plans, and they'll say, I've got this policy and my wife has got this policy, and they're $50,000 policies, and we want to use these we want to use these funds. The only thing is that unless cashing in some of the cash value, we can't have access to that. But it's backed by Prudential or Nationwide or whoever, MetLife, and it's growing. If it's a whole life policy, if it's a term life policy, it's just term. But people come in and they were always looking for a way, like, can you take it? Well, we can't. So, but it's there. Keep it there. It's growing nice. Life insurance works to do exactly what it does. It protects your life, and it'll keep up with the inflationary pressures.
Well, you can't turn the policy over.
You can't turn it over, right?
It's good to know. Anyhow, before they can give you the policy, the person again has passed away. They're dead and buried. And,
Yeah.
And you got to try to get the money.
That's right. Well, and we can assign it. Which is another means. We can assign our expenses to the policy as long as the beneficiary signs the assignment form, which is probably another easy way to do this, because then they send me a check, they send the family a check, we're all done.
You don't get paid till after the policy is
correct.
Payments issued.
Right.
Just got to make sure the term doesn't end before
Right.
the person ends.
Don't get termed out. Don't get termed out. That's exactly right. And it happens, right?
I'm sure.
20 years is 20. Some are 20 years, some are 10 years. So we'll talk cost. A cost. So the whether you get cremated or whether you get buried, we'll do a price range here. You're talking anywhere from $3,000 to the average national price right now, probably about $12,000.
Really?
Yeah, wow. That's what it would cost, depending upon what you select. The old the adage of the people, oh, just take me and burn me. Well, it's not that easy. It's just not that easy. And I'm amazed when I go to the crematory, which is here in Kingston. A lot of people don't know we have a crematory in Kingston at Wiltwick. They just built a beautiful new facility, state of the art. Which
good to know if you're looking to get burned.
That's right.
Or you won't get burned.
Exactly. You'll get burned on time. And it's run by an excellent staff, and they're doing a great job over there. And little plug for them. So, but the people call the crematory and say, I want to, I've had a death in the family, and we want to have you cremated. Well, you need a funeral director in the state of New York. You need someone to take control and possession of that body for that short period of time where the proper paperwork needs to be done. So
you're involved no matter what.
What's that? And no matter what.
Yeah. Well, two things. Again, one thing I can think of is, did I hear right that people get buried with their pets these days?
Yes. Yeah. Here's the thing. For a long time, it was forbidden to bury your pet in your plot in a cemetery in New York State. However, here's the crazy part. If you wanted to get buried in a pet cemetery with your pet, that was allowed.
Get out of town.
No. Yeah.
So the pet had a pet.
The pet had a pet. And, there's a famous pet cemetery down in Hartsdale, New York called the Hartsdale Pet Cemetery. And they're just doing a huge business of people who are buying plots so that they can be buried with Fido or whoever
Hopefully
else.
with Fido or after Fido, because they may outlive Fido.
And that's and then who's going to be Fido's agent, right? That's an interesting question. So yes,
But in our cemeteries, you can't do it.
now your pet can be buried in your plot.
In your plot, with you in the coffin, or
No.
no.
And most pets are cremated, and so the cremated remains may go into the grave. I don't know about a full animal. Have to check into that, but cremated remains may go of a pet may go into your plot now.
It's a whole new business.
There's a new business. Yeah.
I would say the pets usually outlive the human.
Or they tend to replace the pets.
Oh yeah, yes. So that's and I think as anyone that there's a lot of pets that are buried with in the casket with their own. Yeah, sure they do.
I remember we used to put little notes and maybe a bottle of whiskey or something like that in there.
You'd be amazed of what
pack of cigarettes,
personal items, right? Chocolate bars, lottery tickets. Yeah. How do we know we win?
Well, you already won.
You won. That's right. You won. So, I think that's basically what we're talking about pre-planning. Should everybody do it? Absolutely. You wanted to know about whether or not it saves you money. Well, if in my instance where I will write a guarantee, okay, it will save you money over time. The cost of cemetery space and opening of graves and closing of graves, the cost to cremate, they're the items that go up first under inflationary pressure, and then the cost of running the funeral home and providing the service will slowly go up, and you can save money over the long run.
One thing I did notice when the question I had was, we used to have like 2 days. Right. Now it's like an afternoon. Mm-hmm. Why? What happened?
I think
likes the individuals anymore.
Well, I think the first thing the remember that it was like 2.5 days. That got tiring, and I think the general public began to see that it just wasn't it wasn't something that they thought that they needed to facilitate their grief process, and to honor the person who died, and so they did shorten it. They went to a day, remember, and then come back the next day and do your ceremony. In the prevalence and popularity of cremation now, a lot of memorialization takes place in one day. You come in, you do your memorial service, and the cremains are dispersed, and that's the end.
And they don't even do the memorial on the same day anymore. They cremate and bury them and then do a memorial.
Yes. Yeah. But sometimes, right. So the cremation is just a process by which you wait until you can do your memorial. When COVID hit, of course, we were regulated as to how many people we could have in the building.
Right.
And they, in turn, regulated themselves of how long they wanted to be in the building. And we got into the 1 day total. A couple of hours, do the service, done. And or nothing at all. And I found that some people still haven't made their plans after their loved one has died from COVID-related disease. Some people have just, they said they were going to do something later, and it didn't happen.
Is there any truth in the fact that some of the cremations sit in the basement and people don't pick them up?
Mine don't sit in the basement.
Well, they sit someplace.
Yes, yes, and
is that true?
It is true, and it's a liability to the funeral home. So we actually have gone into an agreement of placing them in a permanent place in a cemetery where they can be accessed later on if the family decides.
You rent the spot.
Yep.
Isn't that weird?
Yeah.
Weird. People do that. Yeah. I heard, I know that 'cause some guy, I met this guy in a bar. His mother died, I don't know, 8 years ago, whatever. And his brother was in charge, whatever the deal was. And the brother died. And where's my mother? And he just went and picked her up. I said, well, really?
Yeah.
That's the first time I heard that.
Some strange things. I've had people come to the door of the funeral home with a package that they had just purchased a home, and
They found this?
they found it either in the attic, a closet, down in the basement, and they said, "Is this what we think it is?" Yeah, yes, it is. And then we tried. There's usually a tag, a metal tag that.
Like you do a dog's ear?
Yeah, right. And there's a number on it, but you can kind of cross right. If locally, you could try to cross-reference, but if it happened out of town, there's a possibility that.
What do you do then? You put them in with those those graves that.
No, I just put them in. I put them in with the others that we rent the space with, and just say this is unidentifiable, and maybe maybe
Bury
it
'em
could be
someplace.
someplace. Yeah.
We don't have paupers' graves anymore.
Oh yeah, there's sure. There's a
Why
there's.
couldn't they go there?
Well, I guess they could, but who are they? John Doe.
John Doe.
Yeah.
1, 2, 3, 4, 5. Interesting, huh?
Yeah. Very interesting.
Yeah.
Yeah.
Things you don't think about. But back to the pre-planning. So the pre-planning would go like this: they meet with you, they decide how much they want to spend, they pick out their coffin, maybe.
Yes, they do.
They have the gravesite.
Usually they have a gravesite. If they don't, we send them, and we make an appointment with the cemetery, and when they pick something out, and they take care of that. Stone, monument, that. And
Buy it ahead of time and just plot it there.
Yeah.
That's where you see all those names with no dates.
No dates, just the dash.
There was a great poem one time I heard this priest did in Long Island. It was called The Dash. You know that poem?
I do.
I should have that at mine, The Dash, because it talks about the fact that between the time he was born and the time he died, or she,
right,
all these things happened.
Right. And how did you spend your dash?
Yeah,
right.
yeah.
You know who loves that poem? Do you know Diana Spada?
Yeah.
She loves that poem.
It's a great poem. Did you ever hear that poem, Dan?
Yeah.
That's a first for me.
Yeah, well, you look it up. It's really pretty cool.
It's called The Dash.
And I'm a
Diana loves that.
huge
when they,
poetry
when,
aficionado.
they recite that poem at pretty much every funeral that the family has.
Spadas.
The Spadas.
Yeah.
Yeah.
Well, I think I never heard it. I mean, I haven't heard it since, by the way. It was years ago in Long Island. And this priest there read it. I thought it was pretty moving. Yeah, it was pretty good. Because, everybody gets up there and they go like, and I don't know, but in certain religions, and I'm Catholic, they don't do much about
eulogizing.
Yeah. Whereas the Jewish faith does a great job. So maybe you should have. Can somebody have a Catholic and a Jewish person at the same funeral?
Why not? If they'll do it,
do a eulogy.
And it's a shame. There's and I'm not going to get political and religious here, but some Catholic churches don't allow eulogies, and some do. And I hope the phones don't start ringing. And some Catholic priest thinks that the place for the eulogy is either at the funeral home or at the cemetery or at the gathering afterward. But some of our local priests do allow it in the church. So it depends.
Does Linda Ellis sound familiar?
What's that?
Linda Ellis as
Linda
the
Ellis,
author
the
author of
the
Dash.
Yes.
I read of a man who stood to speak at the funeral of a friend. He referred to the dates on the tombstone from the beginning to the end, and then it goes on from there.
There it is. That's it. Yeah, very good.
Print that.
Yeah. You're very quick there getting
Good.
that info.
Dan is a lot of information. Yeah, I think I'm Catholic, so I don't mind saying that I think the Catholic Church is lacking there. Because this is a time of remembrance, I think.
Most definitely.
And some priests try to do eulogies, but some people just aren't good at it. And sometimes it takes a religious bent, which misses the dash, by the way. And others don't allow it. When my parents died, our parish priest in Rochester, he wasn't going to allow eulogies, and I go, "I'm sorry, Father, it's not going to happen." And he goes, "Okay," and he was really good about it. And I did the eulogies for both my parents, and I learned it from a Jewish funeral. I went to in Albany because I never thought about it, and subsequently I've done my my mother-in-law, my ex-mother-in-law. So I've done a few of them.
Yeah. And people ask me, when they said, we want to do a eulogy, how do we do it? And I said, it's not about you. That's the
It's
most
about
important.
it's
not
about
you.
it's about the person who
And
passed.
some people want to tell their story about themselves, and it's just not your time yet. You know, no, it's not about you. Just that's your theme, and you go from there. And I'm sure that you can find some subject matter.
How many families come in and do a celebration for that deceased person? I think that's a very, very good progressive move forward. Is
True.
doing celebrations.
Yeah, and you know, and they're doing them. They're doing a lot off-site, right? They're incorporating food and music and drink. All right. Interesting thing is that the state changed the laws. I don't know if you didn't know this, but funeral homes were not allowed to have
alcohol.
Well, they're still not allowed to have alcohol, but they were not allowed to have food or drink served in the building. And I think and that was an old law. I've been doing this, like I said, 38 years, and it was on the books then. And they began to change it because of the celebration of life. And people wanted to have cookies passed out at a certain period of time, or they wanted snacks available. And they wanted to come back and have a full luncheon if the facility, offered that. It's a matter of space. I bought the building across the street from mine, and I did the downstairs with tables and chairs, a full kitchen, and give the people the availability and to do that if they want, which was kind of, trend-setting.
You have your own alcohol outside in the parking lot?
Well, there's always that. There's
a celebration.
The trunk is open, so to speak.
Tailgate party.
Here we go.
Tailgate party for John Doe.
Yeah. So does it make sense to pre-plan? Yes, absolutely.
Well, it could be fun, too, for the person.
With me it is.
Yeah, of course it is. Makes your life a little easier. You don't have to listen to people argue.
It's a great, it's a light time, and that's the thing, your mindset is different, right?
I was at a funeral one time, and I thought I was at a riot. I mean, people were so obnoxious to each other, and they were arguing and shouting. I'm like, whoa, good thing that person can't hear. Or maybe they can, I don't know.
And you can tell me this because, don't you feel that the environment of the funeral has changed from being silent, right, sitting there in silence, to the point where now there's conversation. It's a little louder. It's more of a greeting type thing.
Yeah, I think so.
Yeah.
I think that's true. I think that at the same time, I also think that people who go to funerals, and this is my bias, are really disrespectful as hell. I mean, they come with their shorts on and their khaki pants and their a T-shirt, and I'm like, wow, who would do that? Nobody, you don't have to wear a tie, but at least you should dress up a little bit.
Yeah.
But disrespect, it's like going to Walmart, in your pajamas. They feel the same way.
And I know on a Sunday afternoon in the summer, some people come off the golf course and they go, "Oh, I got to stop by that wake," and they walk in and they go, "I'm sorry," My answer is, well, at least you came. But that's.
I think that's okay. It's spur of the moment, but I think ignorance is somewhat of fairly prevalent in our society, whether they're going to a funeral or to a church, to a meeting, I think even going to a doctor's office. I mean, people come in, they got pants on, they got their painting pants on. It's like, whoa, really? And it's sad to see people so disheveled to a point where they don't care how they look. I mean, forget to going in an office. Just like the guy with his pants down around his butt.
It is interesting. It is interesting because
really
I was looking at some
pictures,
great videos of great films of the early 20s and things like that. Every gentleman had a hat on and a suit and an overcoat. Everybody. Culture changes.
Absolutely.
We're trying to find our identity again.
I saw Seabiscuit for like the 6th time, and that generation, they went to the racetrack
with a hat,
with a tie.
Baseball games.
Baseball games, right? Tie, suit, hat, right?
Yep.
And Even in the
Anytime
infield.
you went out.
Yeah.
I mean, I remember my mom dressing us up anytime we went downtown.
Right. My mentor, Mr. Joe Esposito in Rosendale, he always had a hat on. Matter of fact, he gave me a bunch of his hats. He dated them before he died, and I have those hats yet. Every now and then I put them on. I don't go anyplace with them, but I put them on. And he always had a tie on and a white shirt, and he was old school. Well, this has been really interesting. Back to a little summary. So give me a quick summary. We got 1 minute for a summary.
Quick
Bernie.
summary. So everybody should pre-plan if they can. It's a meeting that takes place. Choose your funeral director, call them, make an appointment. If you want to prepay, it's a good idea. The money's placed in a trust. It's safe. It's portable, even irrevocable. Trusts are portable as long as you do it within a 30-day period of time. It makes a lot of sense. And the other thing is if you're able to appoint an agent, and appoint an agent, and that will save a lot of strife most of the time. And let your wishes be known. It's people come in sometime and they say, so what are we going to do? Oh no, we never talked about it. And so make them known. It's we're only here. This is a temporary ride, and it's going to end someday. So and so that's about it.
You did a great job. You'll have to come back, and we can talk again about whatever.
Yeah, we'll talk about funny things that happened on the way to the cemetery.
Yeah, that's a good one. I always thought that was a great idea.
That's a great idea. Yeah.
Okay, how we doing, Dan? Time to go. Bernie, thanks a lot.
Pleasure to be here. Dan, nice to meet you.
Good to meet you too, and thank you so much, Bernie Gray, and thank you so much also John DeCasper for being with us today. And you are listening to KCR, Kingston Community Radio, AM 920 and 92.5 FM. It's Monday, November 29th, and it's about 31 degrees right now here in Uptown Kingston, 32 degrees right now. And this last portion of Kingston Community Radio was brought to you by Ulster Savings Bank, many locations throughout the Mid-Hudson Valley, one near you. And thank you for sharing the morning with us and being with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM, at our live streaming on mykcr.org. Talk radio at its best, inspired discussions of, by, and for the community. And until tomorrow, for a terrific Tuesday, we wish you every success in growing and developing Kingston and all our neighboring communities. This last portion of Kingston Community Radio was brought to you by Ulster Savings Bank. We now return you to Magic 92.5.